Uh, Good morning, Rapid City and all points beyond. My name is Tom Johnson. I'm the CEO and president of Elevate Rapid City. This morning, we are very, very honored to have our probably most distinguished guest so far in this whole series. We've got Senator Thune with us this morning. Senator, welcome to our Facebook Live event. Thanks for joining us today.
Thanks, Tom. Thanks for having me, and appreciate your use of technology for us to kind of still stay connected in these interesting times.
Thanks. Hey, before we start off on all the technicalities or discussions around the bill and the stimulus and all that stuff, anything you want to say to the folks across South Dakota or the Black Hills right now? I just wanted to give you an open invitation to say anything to the citizens that you'd like.
Well, I just tell them to keep hanging in there, Tom. We'll grind through this. It's everybody's kind of got to gut it out, but we'll get on the other side. And I think that obviously for those of us who come from Western South Dakota and know how much life revolves around the travel industry, this is a especially painful time. So, but there are some resources out there that are available that we'll be talking about, I think some today, and people have an opportunity to pursue. But in the meantime, we just got to stop the spread, get this thing behind us and get back to normal. And that's going to take all of us doing what we can and following the guidelines and making sure that we're adhering to the best practices out there when it comes to stopping the spread. I was on a conference call this morning with Dr. Fauci, and he said the only tool we have right now to stop this or slow this is social distancing, which is concerning. And I think we need to there are a couple of ideas I have on the healthcare side, because I don't think until we solve the healthcare crisis, we get the economic issues back in a good place. But that being said, in the meantime, we're going to do everything we can to try and at least lessen the economic impact, the harm that's being caused out there, and hopefully get the worst behind us and get somewhat back to normal before the summer gets underway.
Senator, before we get into the business side, I do want to ask you, I mean, there's no right answer to this. Nobody knows. I heard this morning, if someone tells you they know when this is going to end, they don't really know. But do you have any estimates at the point, right now, since you just got off the phone with him, of when we might see a peak, specifically in the United States or South Dakota? I get this question constantly, Tom, when will it end? When are we going to emerge on the other side of this? And I often say, I think it's going to be three months. There's a reason they passed the stimulus package the way they did to allow us to get to that. Do you have the latest and greatest on that, Senator? What your thoughts might be? Again, we know that nobody can be completely accurate.
Yeah, I don't think nobody knows with certainty. Somebody's described this as sort of like forecasting the weather. You can make assumptions based on the data that you're collecting and feed it into your models and make the best predictions that you can. But the one thing that came out of the conversation today with Dr. Fauci is that you can follow the national numbers, the national trend lines, which the CDC puts out on a daily basis. But it's a big country, when our geography is different, our population base is different, our demographics are different, and that's probably going to be experienced differently in different places around the country, which is why I think in some ways it's hard to look at the national numbers like New York today, and if that starts to bend, curve starts to flatten, it sounds like it might be a little bit, to suggest that means that we're going to be fine. I think that we're going to be probably different. We're going to be a little later to this than maybe some of the coastal states are. But I do think that the more we can implement these social distancing practices, the least or the less amount of damage we can do in terms not only of loss of life, people contracting the disease, but also the economic impact that comes with it, and the quicker we get back to normal. So nobody knows with certainty. I mean, you've heard people talk about, the governor's talking about now July, August timeframe, and the president saying end of April we'll have better data. I think the data is going to have to guide us. The evidence is going to have to guide us. The science, our healthcare professionals listening carefully to what they're saying. But I will tell you this, and I made this point with Dr. Fauci this morning, Tom, short of a vaccine, which probably doesn't happen until sometime early next year, to me, the only way to get us our economy really up and going again is massive testing. And I don't know why, with the amount of resources and technology we have in this country, we can't come up with a test that people can take, that they can find out right away whether they've got it or whether they don't. And if we can figure out who does it and who has it and who doesn't have it, we can get the people who need to be quarantined and get healed and recovered in one place, and the people who don't have it can get back into the workforce. To me, that's really the only way, short of a vaccine, that we're going to get the kind of certainty that people want in terms of how soon we can get back and to work and get the economy rolling again. So I'm encouraging them to push as hard as they can to get a massive testing program out there. You probably heard Abbott Labs came out now where they're saying one they can do, you can get the results right away. And I just think that's what it's going to take. And I hope that we're really focused on the healthcare solution, because these economic problems are all a function or a symptom of that, but we've got to treat the cause. And I think if we can figure out who's got it and who doesn't, we can make a lot better decisions.
Agreed, Senator. In fact, our office right now where I'm from is completely barren except of 2 folks here today, and we're practicing that social distancing ourselves. So it feels real barren. Streets are barren. Definitely feels a different feel. But let's move over, if we can, to the economic side now. We just saw some numbers come out from the Department of Labor in South Dakota about unemployment claims. Around 6,000, 7,000 in the last week alone. They haven't really given us the unemployment number. I tried to take some of those data. Right before this crisis, we were here in Rapid City, the Black Hills. We were around 2.9, even a little bit under unemployment. I think with the new claims data that just came out, we're probably between 5 and 6% unemployment right now today in Rapid City in the Black Hills. So we're already seeing that pain. In fact, I have 2 family members who've already been laid off. So I've personally seen that pain as well. And I just want to say thank you for what you guys have done with that stimulus package. First of all, it's amazing. I've studied the details. I'll ask you a couple questions there, but I want to say thanks out of the gate. But I noticed there were 2, there's 2 sorts of types of loans, and I get this question quite a bit from businesses. Which one should I apply for? So there seems to be this disaster loan, which can be smaller. You go directly through the SBA. And then you've got this payroll protection loan, which can be up to $10 million, on which you go through your bank and lender. And so these are sort of 2 flavors of loans. And this is probably the question I get asked most, Senator, throughout the day. And I have my own opinions, but I would love to hear from the source. Philosophically, how did you guys decide to strike that balance between the 2 different loans? And who were you thinking of when you made that distinction, so that it can help, I think, businesses decide, which direction should they go?
I think that the basic thinking behind that, Tom, was that SBA would be overwhelmed, the agency would, if they had to process loans. And the EIDL loans all come through the SBA. Those are direct loans that are originated there. And that the way to, on a mass scale, to be able to get dollars out there into the economy to these employers so they can keep their employees employed, was to do it through banks. And of course, the model for that is what they call the 7A loan program at SBA. It's a guaranteed loan program where lenders basically, once they're approved and certified, for all intents and purposes, can pretty much make loans with a significant guarantee. Well, in this case, we thought, okay, let's expand that program, make it available to more lenders, and then also, because it's going to be 100% guarantee, banks would have no reason not to participate. And that if the proceeds of the loans were used to pay payroll, or in some cases some fixed costs, mortgage, rent, utilities, and some amount of interest, it would be forgiven. It wouldn't have to be paid back. But the best mechanism to deliver that was through this sort of guaranteed loan program that SBA has been running for a long time. But as I think you probably know, there are also a lot of other lenders who maybe aren't in that program today that are going to be able to originate these loans and want to participate. Now, there are questions among the banks, I will tell you, and we're monitoring this every day. We're getting calls into our office, which we're following up on how the program is going to be implemented. But I think the banks, the proposal is, of course, these are up to 2-year loans. They can be sold in the secondary market, which most people think they will be. And they are 100% guaranteed, 1% interest. And if you look at most federal instruments nowadays, they're about 50 basis points. So there's a premium in there for a lender who originates one of these loans. And we're hoping that there'll be, big subscription among businesses, and that the amount of bureaucracy to get these things actually not only approved but dispensed will go fairly quickly. But again, it's a brand new program. It's a $350 billion authorization, and we expect a ton of businesses to take advantage of it. So we'll see how as they roll it out, and I'm sure there are going to be a lot of hiccups, and we'll try, as we get feedback from your folks out there who are trying to use it, let us know. I think there are about 15 banks in Rapid City and credit unions that are at least right now subscribed and intend to be participating lenders, and we hope that that they are, that there'll be that this thing will go as smoothly as possible, given the fact of the scale that we're talking about and how it's a completely new program.
Yeah, I agree. I think it was a stroke of genius, frankly, to use the banks, because you're right, the SBA would have been overwhelmed. And out here in Western South Dakota, we have a healthy distrust of the federal government anyway. So I think it's good. It's a good option to, yes, it's a good option to say, hey, go talk to your private lender. They have a trusting relationship. So I think it was a smart move. Could you talk a little bit about the timing? What we did here at Elevate is we had access to about $1.9 million of revolving loan funds. And so we loosened up the strings on that, took $750,000, created an emergency bridge loan program. So businesses can apply for $15,000 per business to tide them over during this period that you described as, the part of the bureaucracy as it gets started. And so we've done a 90-day loan program with an extension, so we can go up to 4 months while that SBA money is coming in. I get that question quite a bit, Senator. Do you have a sense of how fast the SBA can get, whether it's through the bank, through the payroll protection, or through the disaster loan program, which is a $2 million loan versus the 10? Do you anticipate, how long that'll take, or how fast they can get that money out on the street in terms of, days, or is it a month and a half? I get that question quite a bit.
Well, I guess my hope would be as quickly as possible. But again, knowing that this is brand new, the rollout, and the starting tomorrow, actually, we're talking about most small businesses being able to apply, independent contractors and folks in the sort of the gig economy, if you will, would come like a week later on the 10th of April. But that application process is going to get underway. And I heard from the secretary this morning, Mnuchin, that their guys are up until 4 a.m. trying to make sure this thing was ready to roll out. So, we can all hope and pray that it goes smoothly, but we all know from experience that anything that you do on this scale, that even though it is going to be the delivery mechanism is the banks as opposed to the federal government is still a plan and a program that's going to take a massive amount of delivery and sort of architecture to get done. So, I'm hoping that it'll go smoothly and quickly, Tom. I guess my view is that, the way this thing was designed, it was in hopes that we could sort of at least stall or put off, get us past the worst, and then hopefully, we can take another look at what we need to do next. But I like the way you're approaching it. I think for your businesses out there right now, more than anything else, they need is cash flow. They need liquidity. They need to be able to pay bills. And until this thing gets up and functional, what you guys are doing to kind of bridge that is a really good approach to it. Because in the end, if they can, get these things approved and they can keep their employees employed, keep, paying the rent and those sorts of things. And this is an 8-week program, and who knows, at the end of the 8 weeks, we'll have to reevaluate whether it needs to be extended further or expanded or whatever. But this is designed to at least help get businesses through these critical days where they're having to furlough and lay off employees, and just try and keep them there. We want to keep workers connected to their employers and try and keep these jobs there so they don't go away. And that was the whole sort of idea, theory, thought behind this particular program.
And Senator, also thanks to you guys also for allowing that SBA money to take out existing debt, because we wouldn't have been able to probably put this program into place. Because one of the things we're telling the folks that are applying to us for these $15,000 loans is, hey, we'll bridge the gap. When that SBA money comes in, it can actually take out our local $15,000. And so it allows us a little bit more comfort so that the loans aren't risky. So I don't know if you had that in anticipated consequence, but thank you very much for that, because it allowed us to jump in and play a role here locally. So thank you. Glad you are. One of the questions we get to a lot is the sole proprietor. We talk about businesses, and we tend to think of businesses, with 5, 6, up to 500. How do you advise those folks that talk to you that are sole proprietors in terms of these loans? I know these 2 loans can go to sole proprietors, and I have told sole proprietors that you also, depending on whether you're affected by the crisis, you would be eligible for unemployment insurance as well. Could you maybe talk about how you guys structured this, both the loan side and the unemployment insurance, around the ability to help sole proprietors or those that are self-employed?
Yeah, and sole proprietors and independent contractors, people in the gig economy, are all eligible under both programs. The hope is that the Paycheck Protection Program will be the one most utilized because it keeps people in the workforce. It keeps them employed, even though the business may not, obviously isn't going to be functioning at a significant capacity for the foreseeable future, but at least it keeps people on the payroll, keeps people, the business is functioning, although on a smaller or a more limited level. But the UI program was created to, if you get laid off or if you are a self-employed person and your business basically goes under, you can't pay yourself, then the UI program kicks in. And what the federal program does is it complements, or I guess you'd say supplements, what the state program does. So whatever the state pays out per week in unemployment benefits, plus that up by $600 per person per week. So basically what the feds did is they topped off the unemployment accounts at the state level, and that program will be available for 4 months, basically. So you'll be able to, if this thing does extend for a while and you have to go on unemployment, it's there for you. But obviously our preference, and I think everybody's preference, would be to keep the businesses viable and functioning, and that they'd be able to take advantage of the Paycheck Protection Program, and then avoid having to go on unemployment. But they're both there, and they're both sort of create, I think, a platform that people can use if necessary, and just keep people going. And right now that's what we got to do until we get the worst of this behind us.
Senator, again, just had to laud you all for thinking about the future being uncertain there. The ability for this to go out before additional months, I think, really reflects that concept that you mentioned earlier, which is that we're not sure how long it's going to last, so let's make it happen for 4 months so that it allows us the flexibility to keep these folks with those checks coming in. And I just want to say thanks because we don't know what the future is going to look like. When we did our loan program, we had the same thing. Did we make it 60, 30, 90? We ultimately said 120, which is 4 months, because we had that same concept. So thanks on that. We're getting a lot of questions now coming in on Facebook. One of the ones, again, I've heard this answered naturally, but I thought I'd just give you the chance to weigh in on this. These direct payments, we get a lot of questions about that. How fast do you think these direct payments, we hear a lot of different ideas about how fast these direct payments are going to be, the $1,200 for individuals, and then the family, the income level restrictions, also the $500 per child. How fast do you think those are going to get out to citizens in South Dakota?
Well, Secretary Mnuchin said this morning, and again, I'll tell you what he told us, and we'll see, obviously, if they can make it happen. But he thought 3 weeks, and I think a lot of it has to do too with sort of, is your information available? Do you electronically file? Can they make that payment electronically? And so some of it will probably depend upon how much paperwork is associated with the process. But to the degree that people make it simple by connecting it to their 2019 filing, or if they haven't filed in 2019 yet, we did defer that to their 2018 return, then that's the IRS has that information, and they should be able to get the checks out. So they said 3 weeks, and that may be somewhat optimistic, but at least hopefully they're thinking aggressively, trying to do their best to make sure that it gets out there as quickly as possible. And I know there are a lot of questions around not only the timing of it, but who qualifies, and they're trying to do their best to define that as well. And I think that, hopefully if you're a wage earner out there or a senior citizen, everybody's going to be, pretty much everybody, with some exceptions, are going to be eligible for these.
This is a question we got too off of Facebook, Senator, and it's a simple question, so you can go a lot of directions with this one. How do you believe this will affect Social Security? I assume the gist behind the question here is that there's the idea that this could affect Social Security, but do you anticipate this affecting Social Security, and if so, how?
Well, I mean, we had, before all this, challenges with entitlement programs like Social Security, Medicare, Medicaid, what we call so-called mandatory parts of the federal budget. And they are, all of those programs need to be modernized, updated, made more sustainable. So this may force us sooner to take a hard look at that. But no, I mean, in terms of the dollars, if the question has to do with dollars coming into the,
I think that's what they were coming from, yeah.
That's what they were getting at, yeah. So we allowed the payroll tax to be deferred for businesses until the end of the year, which again was designed to provide liquidity so that businesses who are having a hard time, if they need to stay viable, need to stay afloat, this would create that cash flow, that liquidity that would get them through the end of the year. But those payroll taxes do have to be paid back, and it would come in two sums: end of 21, end of 22. So those dollars are not they're not going away. They're simply being deferred or delayed in terms of the payments. Obviously, you lose some of the value, the time value of money associated with that by not having those dollars in the Treasury today. But the thinking was, what is a way that doesn't impair the Social Security Trust Fund, but also creates that kind of liquidity for businesses out there to get through this? And the payroll, tax extension or deferral was one way that we came up with, and it's a significant amount of money. I mean, if you look at what that generates in terms of cash flow, it's a big sum. So, but it's not. The liability doesn't go away. It's just been deferred.
Senator, anytime I hear a politician say the word time value of money, I know I'm dealing with a smart guy because I'm a finance guy. And when I think about time value of money, and the fact that you said that, it's just it warms my heart during a time of crisis. Thank you for saying that. I forgot to ask a question, and this just came in too, so I'm glad it reminded me. Sometimes when I'm talking to businesses, they say, the first thing is, I don't know if I can trust the federal government. And then they say, well, these loans have to be paid back. And then they don't like the interest piece a little bit. There is a provision that allows, at least in the disaster loan, it looks like $10,000 of advanced forgiveness on that. There does seem to be some more flexibility in forgiveness on the payroll protection. Could you talk a little bit about that forgiveness? That does come up quite a bit. I think they sort of want me to guarantee them that most of this money will be turned into a grant. And I try to not go into assurances, but could you maybe talk a little bit about how you see both the disaster and the payroll protection ending up looking in terms of at the end of this, and how much is forgiven?
Yeah, I mean, the EIDL program is, again, administered through SBA, so they have sort of their own procedures in dealing with that. And generally speaking, those are longer term duration loans. Those tend to be 30-year loans. They have to be paid back. They have to be collateralized. These PPP loans don't have to be collateralized. You don't have to offer a personal guarantee. And all you have to do is demonstrate what your payroll was. And if you get a loan that equals that amount of weeks of your payroll and you use it for payroll, it will be forgiven. And that's what the law says. So I understand. I would be skeptical probably as well if I was a business person and I was going to apply for a loan. They said, oh yeah, we might forgive it down the road. But it's very clear. The law stipulates that if it's used for these purposes. Now, if, for example, you reduce, your workforce, or you cut people's pay, your payroll goes down over the course of this loan, then that amount would have to be paid back. So basically, what is being offered here is essentially, it's a 100% guaranteed loan, forgiven if certain conditions are met, and the principal condition being that it's used to keep your employees employed. Other things can be covered. You mentioned some debt service, but also utilities and rent and that sort of thing, at least up to a point. But the main purpose of this was, if you can demonstrate, you come into the bank and say, okay, here's my pay stub, payroll, information for my workforce, and I need a loan in this amount to cover it until this date. That's basically, if you're, and then you can demonstrate that it was used for payroll, then it's going to be forgiven. It essentially becomes a grant, but it was delivered in the form of a loan simply because the banks were the best delivery mechanism to get it out there, and at least provide some system that had at least a little bit of accounting for that too. So the banks will then, and the federal government, I'm sure at some point too, will verify and audit to ensure that these were all used for payroll. But if they are used for payroll, that was the design behind this program.
Senator, I've run into a couple businesses that they may have decided to cut payroll already. Again, you can't blame them. This is a really uncertain future right now, and so they were looking out on the horizon. They thought, oh gosh, I better get out ahead of this. Maybe they cut payroll, and then some of this stuff came out, and maybe they thought, gosh, maybe I should have kept those folks on. It sounds like there's the capacity for them to rehire right now and still benefit from these programs. is there a deadline or a date in which you would say if you're going to rehire those folks, if you've laid somebody off right now or in the last couple of weeks, and you see that you want to take advantage of this program, can they number one, can they, I think the answer is yes, but can they rehire right now? And when would be the deadline that you know of which they could rehire those folks and then go ahead and apply and take advantage of these two programs?
The effective window, and the operative timeline in terms of a retroactive date is February 15th. So you take what your workforce was on Feb 15, and then if you have laid people off already and they were laid off after February 15th and you rehire them, then you would be able to count them as part of your payroll. So it's the window is basically Feb 15 to April 30 to be eligible for this. And so whatever your payroll was, and if you had already started to furlough or lay people off and you want to bring them back on, as long as you didn't fire them or furlough them, I should say, before the 15th of February, you would be eligible.
So if you're out there right now and you're a business saying, I'm thinking about bringing folks back, it looks like you've got till April 30th to do that.
Correct.
Okay.
Yes.
That's great. I got to tell you that has happened a few times, and again, you can't blame businesses for trying to make a decision that affects cash flow. So
no, I know
that's really good.
And the more information people have, the better decisions they can make. So I get that.
Wow, that's great. I didn't know that I had heard June. I had heard do it immediately. I didn't know when the day was. So that is really, really helpful. Another question we just got, and this is probably a little bit harder to answer, so you may want to be philosophical about this. And I get it too a lot. Okay, South Dakota, especially Western South Dakota, is supported heavily by tourism. What support would you say is out there for more seasonal businesses? And specifically, the Black Hills have got hoteliers, some of those seasonal businesses. Is there something specific that you would say is out there for those folks, or what they maybe should be thinking about if they want to also benefit?
Yeah, I mean, there's another program that is has a limited duration too. It's called an employee retention program, and that program you can get 50% of your basically qualified costs for labor up to $10,000. It's a 50% credit up to $10,000 per employee. So it's $5,000 basically per employee. And so there were some things that were put in that were sort of designed to help, I think, for those who didn't qualify for the PPP, for the Paycheck Protection Program, the forgivable loan program. And so there is an employee retention program that other businesses could be, I think that could fit the eligibility requirements there. And I think that, there are some other provisions in the law, again, deferral of payroll tax, for example, that I think pretty much any of these businesses could take advantage of. Some things on the tax side too that I would take a look at, trying to think of how they might apply in the case of a seasonal operation. But I know firsthand, having grown up in Murdo and worked in, my brothers worked in filling stations. I cooked at the restaurant, my sister waited tables, and my other brother worked at the Pioneer Auto Museum. So, our lives, and my parents during the summer months, my dad was a teacher, managed a motel. So, our lives revolved around the travel industry. And I get that basically you got a window to make it there that starts sometime mid-May and basically goes until the end of August. And so it's a different animal. And sometimes hard to design a program specifically for that. But I think there are a couple things that I would take a look at, and we can certainly get more information to your folks about that, Tom.
Great. We'll get offline with Kasai or somebody else and make sure we get that information. By the way, I have to throw out a shout out to Kasai. I've been here, and I took this job about 5-6 months ago. The time blends now with the crisis, and Kasai has been amazing to work with. So I thought I'd get that shout out there. I'm sure he'll be embarrassed and appreciate that. But let me get on with a couple more questions.
Thank you for mentioning that, Tom. And I would encourage everybody, Kasai is a terrific resource. And I'm glad, I know you guys work well together, but I would encourage anybody who's on out there today that's watching this too. And I know it's, we've kind of been, I know in our office out there, it's the traffic's been heavy the last few days too. So be patient, but if you need a resource that just has got a tremendous amount of experience and counsel and insight, Kasai is in the team out there along with him, hopefully, or will certainly fit that bill. So take advantage of it. Thank you.
Yeah, I often think, Senator, that Kasai forgets more in 5 minutes than I've learned in 5 months. That's how good Kasai is. But yeah, your entire staff, frankly, in South Dakota has been amazing to work with, including up till today. So we're getting other questions. One here is, let me see, pick one that I think might be of interest. Oh, yes. We've seen the healthcare industry, the burdens on the hospitals, masks and everything else. There's stuff in this bill that provides relief for the healthcare industry. You maybe talk about how that relief is going to go to the hospitals and how they're so burdened right now, and we hear about the shortage of masks. What in this bill allows for more, maybe building of hospitals, more relief for dollars to go to healthcare workers and providers. Could you talk a little bit about that?
Yeah, I mean, the number for healthcare providers in the bill was substantial. And the answer to how it's going to be distributed is still, I think, being formulated. The Department of Health and Human Services, and more specifically, the Center for Medicare and Medicaid Services, which will be key to getting these dollars out there to healthcare providers, I think is still coming up with a methodology for how they're going to get funds out. Now, the American Hospital Association has suggested one idea is $25,000 per bed. Or per bed per hospital. So however many beds a hospital has, $25,000 per bed to deal with this immediate crisis. I don't know, that's again one proposal. I'm not saying it's going to end up being anything like that, but I think they're still coming up with that. But we know, everybody knows what a strain this is putting on our healthcare providers, and that it would include nursing homes, long-term care facilities as well, who are, those people are saints, just taking care of our elderly population at a time when they're especially even more vulnerable than normal. And the other thing I would mention too is there were some other, in addition to the $100 billion that's going out in sort of a direct infusion into the hospitals, there are also some changes that we made in the Medicare program that provide relief. There was a 2% reduction in reimbursements under Medicare that was approved as part of the legislation that we had passed previously. We repealed that for the duration of this, and we made some other changes. If you're treating a COVID patient, we increased significantly the amount of reimbursement that person would get. Did some things to help others in the healthcare space, physicians, nurses. And so it's a big infusion of dollars going out there, but how that gets distributed ultimately is still at least partly being determined. But I know that there's help on the way, there's help coming. And my priority in all this is those rural hospitals too, because those community hospitals in smaller towns, you got Monument out there, and obviously this is going to impact them in a big way, but they also have facilities all across western South Dakota. There are some independent facilities all across the western part of the state. And just making sure that rural hospitals are able to survive this is something that, as I was looking at what we're doing to help hospitals first and foremost in mind, and we've been in touch with those guys on a daily basis as they are trying to come up with how best to do this to make sure that rural hospitals are a priority.
Senator, this is, as you know, out here we've got Ellsworth Health Force Base, and you were critical to, throughout your career to making sure that place didn't close, to the announcement of the B1, to the expansion. We expect that could be a big growth for us coming out of this crisis. We did get this question. Do you think this is going to affect the Ellsworth project going forward? The plans for the long term? Is this crisis at all going to hurt or affect Ellsworth in your view?
No, and you're right. We're going to keep our pedal down. We're going to keep our foot on the pedal when it comes to Ellsworth. That's got to be full speed ahead. The fact that we're dealing with this sort of a threat is obviously something that we were not expecting, or certainly not something that we saw coming very early on. Although it looks like now that there were some warning signs coming, but the other threats that we face around the world continue. And we can't take our eye off protecting Americans and American interests around the world. And to do that, we need the kind of weapon systems that Ellsworth not only has today, but will have in the future with the B-21. And so we're going to keep pressing on, making sure that America is prepared on every level to defend itself, and to make sure that we're defending America's interests around the world and protecting our freedom. So the B-21 and the work the B-1 does today, the other work that's done out there by the predators in those missions are something that we cannot take our eye off of. So be assured that as we're fighting this battle, we're prepared to fight the battles of the future, and we're going to continue to prepare for that. And everything that's being done right now at Ellsworth is getting ready for that next mission. So we're going to continue to monitor that progress and make sure we're doing everything we can to assist it.
Thank you. I know a lot of folks hearing that message, Senator, will be really, really relieved to hear that. It's such a big part of our economy, as you know better than anybody, how important those airmen and airwomen are to what we do, and integrating them into the community as we continue to grow as a community. That's so important. Let's move on, if we could. When I talked to Congressman Johnson last week, I sort of felt like he was wanting to apologize a little bit because when the bill didn't really have a ton of stuff for 501c6s. So Elevate Rapid City, for instance, or any chamber of commerce or any business association, we're a 501c6. And it didn't look like the bill quite really dealt with 501c6s in terms of the ability for them to get loans. And maybe that's changed, but can you talk a little bit about the thought there? Again, this is not necessarily a criticism, but do you anticipate, it looks like there's now maybe $10,000 that could go to C6s possibly as part of this. What's the latest on how you see the C6s playing into this? And again, I know that's a hard question because there's so many different C1s.
There are lots of Cs, and some of them are eligible for the PPP program. C6s just don't happen to be. So that's why I suggested this employee retention program as a possibility. The payroll tax deferral, some of the other things there's some benefits out there, again, which we will work with you and others, Tom, who fit that definition to make sure that everybody who, that to the degree that there are resources out there that are available, that we make sure that people are taking advantage of that. But there's some, as you're trying to design these things and you're trying to think through, okay, who's eligible for this, who's eligible for that. There are certain statutory definitions that preclude certain organizations from being eligible for some of these programs, and you're trying to figure out who's falling through the cracks here. And inevitably, there are always folks that in a deal this big with this scope and size, you don't contemplate fully how you're going to help. But there are a few tools out there, a few levers out there, I think, that organizations like yours and other sixes can throw, and we'd be happy to work with you to help develop those and figure out what works.
Yeah, thanks, Senator. Again, this is Western South Dakota. We're a tough stock of group folks here, so we don't want to come across as complaining or whining. And we're going to get through this, one way or the other. And even if our revenues go down, we'll weather the storm. So thank you for thinking of us. I know that there is relief for states and local governments in this, and I thought this was another stroke of genius on your behalf, that each state is required, even the small states. It says here 1.25 billion. So that sounds like even smaller South Dakota, the rural state, is going to get 1.25 billion. Number one, can you confirm that? Because I find that almost to make me a little bit giddy. But also, how would you see that playing itself out, and how would South Dakota want to look at? That's a lot of money. So what would you anticipate we do with that 1.25 billion dollars?
Well, and I've heard from the governor on that already as well. But yeah, it's a big sum, and of course they're complaining in New York because out of that allocation, New York got I think 3.8 billion, and they think that's not even close to what their need is. And most governors, I will tell you, Tom, want to use it to replace lost revenue. The law requires that it be used for COVID-related expenses. Now that obviously creates, and the Treasury has indicated that they'll exercise, great flexibility in that stabilization fund as much as they can under the law. But it was designed to try and help with this immediate crisis. And let's certainly hope it doesn't take 1.25 billion here in South Dakota to deal with just COVID-related costs. But I'm sure there'll be future discussions about how those dollars, what qualified uses might be, what an eligible event might be, and so we'll continue to work with the states on that. But yeah, that number was kind of eye-popping, and it's one that we us smaller states were working to make sure that this didn't all go to the New Yorks and Californias, and they put a de minimis amount in for each state, and it certainly happens to be it's a chunk of change for South Dakota.
And thanks for doing that, Senator. We know you're always looking out for us, and that was just awesome. Even if that doesn't all get to South Dakota, we don't spend it all, and we figure that out. I know right now we're thinking about we're bringing Kasai in, bringing the mayor in, bringing Elevate in, bringing our county in, and talking about that 1.25, and how can we get in front of Governor Nome to let her know what we believe Western South Dakota needs. So we're definitely going to go talk to the governor at some point and see if there's things.
And I think that's a good discussion to have, Tom, because I think there'll be some flexibility for the state to help with municipalities. If you're a municipality over $500,000, I think you get an automatic allocation, but for municipalities under that number, and we don't have any, of course, in South Dakota qualify for that, it's kind of comes through the state, and it'll have to be, the cities will have to work with the state in terms of trying to figure out what's the best way to distribute and cover the costs that they're experiencing. So I would encourage you to have those discussions and involve Kasai and the governor's office, and hopefully we'll get some clarity on that.
Yeah, we definitely want to make our voice known out here in Western South Dakota. Senator, I never knew there was this East River, West River thing until I got here. I grew up in Wyoming, and I went into a shop and saw a T-shirt that said "Us versus Them," and it had the state separated by a river. I thought that's strange to divide yourself of 900,000 people into that, this river thing. So that was funny. But we'll work together here in the West River to try to make our voice known. Let's see. Okay, here's one. Yes. Okay. So, clearly you alluded to this before. There are things maybe that fell through the cracks in this first 2 or 3 go-arounds with this bill. Do you anticipate going back a 4th time or a 5th if needed to sort of quote unquote fix things or try to shore up some things that maybe you missed? Is that something you guys are going to do?
Sure. And I think there inevitably there will be things that we missed or things that come up that we didn't anticipate that we'll have to respond to. And we will do whatever it takes to get the country through this. Obviously we want to see how these current bills we passed now 1, 2, 3 coronavirus, so 1, 2, 3 packages, phase 1, 2, 3, I guess you'd say. And there's a significant amount of resources going out there. Now, whether or not it's going to be sufficient to what we need remains to be seen. But what I will tell you is that we are totally committed and will do whatever it takes to see that our country and our state weathers this storm. And the sooner the better. I mean, I hope we can get back to normal, which is why I come back to my original point. We got to beat the healthcare crisis. And I think, obviously, getting a vaccine as quickly as possible. But until that happens, figure out a way to test everybody in this country. Let's figure out who's healthy and who needs to, be hospitalized or treated or quarantined. And the sooner we get everybody tested, I think the more we can get healthy people back into the workforce and get the economy going again. So, we've got a big challenge ahead of us, but we'll do whatever it takes.
Senator, when do you think the vaccine might be available? I know that's one of those uncertain future kind of questions, but do you anticipate a range of dates when we might see a vaccine? I know folks have asked me that question.
Well, in that question, we posed that of Dr. Fauci this morning, and they have several companies now that are in the process of doing the research and the testing. And what in this latest bill that we passed, what we did was we allowed a couple of these manufacturers, or made it available, some dollars available for them to begin to manufacture the drug that's currently being tested, hoping that the tests are effective and work. And then when the tests are done, you don't have to wait another few months to get the scale up and get the drug out there, the vaccine out there in the amounts that are necessary to basically give people some comfort level that we're on top of this. The problem you have is because of the FDA and all the tests, they got to do all these clinical tests, takes a long time, and they're working through that right now. But I think your best case scenario probably is early next year. And to me, that's unacceptable in terms of what we're dealing with between now and then. I think we need to have some solutions in place prior to the time that we have a vaccine. And again, there's some therapies, some antibody work that's being done where you can figure out who's developed immunity to this. But to me, testing is a huge part of this equation. But that being said, to respond more specifically or directly to your question, we think it's probably going to be early next year at the earliest. And I think the steps that are being taken right now to try and short circuit, or I shouldn't say short circuit, that's not accurate, but truncate, eliminate some of the time that it takes to get something out there in the marketplace after it's been approved by the FDA. We're trying to eliminate some of those, that extra time that we don't think, right now, we just got to get the vaccine as soon as we can.
Yeah, I agree. Here's a question that came up, and I probably should have asked this earlier, but in Rapid City, one of the things I think that's really been a boon for Rapid City is our amazing airport. You can get direct flights out of Rapid City to Minneapolis, Chicago, Los Angeles, and Salt Lake and Dallas, and a lot of other places during the summer too. So for the size of a community this size, our airport is essentially world class. So you don't see a lot of communities our size with that kind of air service. In this bill, and I know the answer is yes, but could you talk a little bit about what you're doing to help airports, maybe the airlines, and how those two fit together so that we can continue to make sure that we've got that critical infrastructure?
Yeah, the airlines, the commercial airlines, the regional carriers, the cargo companies are all going to have access to a credit facility being set up at the Treasury that would create a sort of a loan program, and coupled with some other dollars that would be available to them, subject to some conditions, and when it comes to payback and allowing the taxpayers to participate in whatever upside happens with their when they ultimately come back around, which we all know that they will eventually. So that's kind of deals with the airlines themselves. They've got access to this credit facility that was put in there specifically, not only for them, but for other sort of essential businesses that are key to our national security. And then with respect to the airports themselves, we knew, and we were hearing from, because every airport, every vendor, every commercial operation out there at the airport, concessionaires, that sort of thing, right now is just out of business, because I saw the numbers yesterday out of Rapid City. 24 people flew out of Rapid. That's just insane. And so it's unsustainable, and that means that all the airports suffer as well, because they rely on the revenue coming in from the airlines to continue to make improvements and keep all those things going at the airport. So there's a $10 billion amount that was allocated in the bill specifically for airports. And the here in South Dakota, at least, the state of South Dakota Department of Transportation would be responsible for determining where those dollars need to go, which airports, how they distribute that. But the airport improvement program, which is funded through the DOT, and as a result of all the revenues that come into our airports, is obviously going to be depleted. So this $10 billion was designed to replenish, especially those airports that are really experiencing significant economic impact and harm. And certainly in South Dakota, where we're served by regional carriers, we're going to fit that category. So there's some help on the way. Again, I wish I had more specific answers about how those dollars are going to be distributed, but we did put money in the bill, knowing full well that with airlines not operating, airports are going to be suffering as well.
Yeah, with so much money deployed, it's hard to know all the details of all this. And there's almost this factor of, we've got to trust, because we all got to come together as a country and sort of trust this is going to work out. That's an American value. So, I appreciate that too. And I think we all have to come together. And, it's the federal government, but we need to have a little bit more trust at this moment during this crisis, pull together and know that those dollars are going to be there. Senator, there's a question that we got to, and I think this is an interesting one. I don't know that it's an easy one to answer, because I'm thinking right now, how the heck would I answer this? But I'll throw it out there and give you a chance. One of the most difficult parts of this whole situation has been sort of the inconsistency of shutdowns, whether it's local, federal, state. Different parts of the country are shutting down these types of businesses, and others are doing shelter in place. And you read about your neighbors in Minnesota or Colorado. Well, they're not our neighbors exactly, but they're close by.
Yeah.
They're sheltered in place.
They're
So there's they're the neighborhood, exactly. Sometimes they're the neighborhood bully, frankly. But you get these shelter in place. You hear about this person shutting down, these businesses. It's hard, I think, as an average citizen to know, what does it all mean? Is there any discussion at the federal level, at least, about creating some benchmarks about when things are going to stabilize and when things should reopen? I know President Trump has talked about various timelines, and then he said to moves out a little bit depending on the data. Has there been talk about some benchmarks that would allow us to know when things will systematically return, and what would those benchmarks be?
Yeah, and it's hard. It's a hard one to do, Tom, for the reason I mentioned earlier is that the country is so vast and we have so many different pockets that are reacting to this in different ways. I mean, I don't think our experience is probably going to be New York's experience. At least I certainly hope not. But, so it's hard to measure, knowing, again, full well that what's hit the coast hasn't really come to the heartland yet. We're seeing more, obviously, cases out here. But I think there are metrics that we need to pay attention to. And of course, cases per day is obviously one of those. And when you start seeing, like you are in New York now, cases per day starting to level off, hopefully that starts to come back down. Now, the bad news is there's usually a lag of a week or two on deaths. So when you see the cases might be leveling off, and deaths from those cases could continue to go up for a while because there's a couple-week lag. But I think that we've got to have metrics that we're following that give people some sense of, when will normalcy return? And I think that's an important part of this. And I think that there are too many numbers being used out there. For example, some people will use an aggregate number. Some people will use a per capita number when they're looking at things, comparing us to Italy or South Korea or someplace else. And I think what we need as much as possible is a consistent metric that we can sort of measure and determine if, when things start to improve, when the curve starts to flatten, that we're getting ahead of this thing. And I think Dr. Fauci, would tell you first and foremost, that's cases per day. But just, I think we have to understand that even when cases per day start to level off, that we could see continual, mortality, additional fatalities from that, because that there's a tail on that. And I think we just need to be prepared for that. The American people need to know. I certainly hope at least that what they're doing in terms of their modeling today is worst case scenario, and that we'll see a lesser incidence, not only of cases, but of also people who lose their lives to this disease. But I think they're trying to prepare us. But I do think we need consistent metrics that are consistent over time and give us a sense really of where we are. And not just in, New York, which is the national number, but I think that's why every state's doing its best to keep track of it as well. And I think you can see in Nebraska, North Dakota, Wyoming, places like that, you're probably going to have different experience. You get out in Western South Dakota, where I'm from, people are far apart anyway. I mean, you're kind of socially distanced there, whether you like it or not. But our population centers, Sioux Falls and Rapid City and some of the other cities across South Dakota could very well experience numbers that, for some time now into the future. And I think we have to, I know the governor's listening to the healthcare providers, the experts, also looking at data, looking at analytics, looking at the science, and trying to make the best decisions that she can. And our cities are doing the same thing. So we're all in this together. And we just got to battle through, gut it out, and get back to normal. Because I hope that when things return to normal, we're going to see a huge, there's a lot of pent-up demand out there, and I'm hoping that things are really going to take off again.
Senator, you talk about the need for testing, and it seems like that's a common theme throughout this talk, is the testing and testing. We hear anecdotal evidence about not being enough tests, that most of the tests are going to New York, and so they're just not enough for South Dakota. Could you talk about when you think those tests will be available? And maybe that's just an anecdote. Maybe there's enough tests now and they're coming, but you do hear that here in Western South Dakota. Gosh, they don't have enough tests and they're all going somewhere else. So, could you talk a little bit about that?
Well, we've heard that, and we've heard from Western South Dakota, and my office has responded to some of those concerns, and we've gotten help to get some additional tests out there for your medical providers. But there is a competition for tests, and it does seem like right now, and of course, I guess as you would expect, going to places like New York, where they've got the most critical conditions right now, would make some sense. But what I'm saying is, we're spending tens, hundreds of billions, trillions of dollars on this thing, responding to the symptoms. We need to be treating the cause. And that's, getting ahead of the healthcare crisis part of this. And one of the ways, in my view, at least, that you can limit the economic damage is if we have to put money into all those pharmaceutical companies and folks out there, labs that are developing these tests on a mass scale, let's get tests out there that people can do that they can look at, or send through technology to their provider and say, okay, you're clear, you're clear, you're clear. Oh, you've got it, and you need to be quarantined, and we're going to get you better and all that. But let's just figure out who has this and who doesn't, and those that don't, we can get back out in there and get this back into the workplace. And so I just think that testing is a huge part of this solution, and I conveyed that this morning, again, as I mentioned, to Dr. Fauci, and he heard that not only from me but a few others who hopefully are carrying it back to the administration. But let's put everything into getting these tests out there so we can figure out where we are. I mean, right now we don't know. There's so many asymptomatic people who are carrying it. There are folks that have mild symptoms and you don't know they have it. And I think the more information, the more data we have, the more informed our decision making will become.
Senator, I know we've reached the end of our hour with you. I just want to again personally thank you on behalf of Delaware Rapid City, the city, the community, West River. You're the kind of congressman that I got to tell you, or senator, that is the kind you want. Tough, genuine, vulnerable, get stuff done. I can't thank you enough. Anything you want to say to the group or the folks out there before we let you go today? I know you're a really busy guy.
No, thank you, Tom. Thanks for the opportunity, and thanks for the work you're doing with Elevate Rapid City. I just think that, right now we need people in leadership who get what we're up against and understand what the business community needs in terms to get through this. And thank you for doing that. And thanks for the good work that all the folks that are on this call today out there are doing every day. I know it's a hard time. We will get through it. We just got to make sure that we're doing everything we can right now, which again, from a preventive standpoint to combat this is the social distancing. That's really the only tool we have at the moment, but hopefully there'll be more tools in the future. And in the meantime, we want to make sure people get through this. So you and your organization, and make sure you're staying in touch with us, with Kasai out there, and we'll do our very best to respond and make sure that we're all pulling together. So we'll get through it, but some things aren't easy, but in Western South Dakota, we've known that for a long time.
Senator, thanks again so much. Stay safe yourself. We know you're putting in 24/7 for us out here, and God bless you, and we'll see you down the trail. Thank you.
You too. Thanks, Tom. See you. Bye now.
Okay.